So welcoming Dr. Banshi Saboo to the forum. Thank you for joining, sir. In a few words, I'll just introduce the doctor because everyone knows about him. I'll not take much time. He's Chief Diabetologist and Chairman of DiaCare, Diabetes Care and Hormone Clinic at Ahmedabad, honored with Fellowship of American College of Endocrinology, American College of Physicians, International College of Nutrition, Royal College of Physicians, and MNA MS. He is International Diabetes Federation Chair-elect for Southeast Asia 23-24, immediate past president of RSSDI, Research Society for Study of Diabetes in India, president of Indian Obesity Society, honorable vice president of Diabetes in Asia Study Group, honorary secretary of Diabetes India, and the list goes on. So Dr. Saboo, I'll not read out much. The topic on which he is going to talk about is what the medical professionals say as a social cause, how pharma can help to delay the pre-diabetics from becoming patients with diabetics. So Dr. Banshi Saboo, over to you. Please enlighten us with your thoughts, sir.
Thank you. First of all, thanks, Swati, for kind words of introduction. Thank you, Ashokji, for giving me an opportunity to talk on it. And it is really very difficult, after Sanjay and then Sanjeev, both of them are close friend and great speaker to talk on. And it's really a new forum for me to talk, because something which we normally talk to our patients or to the doctors community or to the diabetes community, where something new comes and we just talk on some scientific basis. So it's really new, and I was very excited also. I was thinking that what I should talk on this particular platform. Let me share my slide. My voice and everything is clear now? So the topic given to me is a social cause, how pharma can help to delay the pre-diabetics from becoming person with diabetes. Before I talk about this, we should talk about how diabetes had become really a big problem for our country as well as all over the world. This also, I'm sure many of you must have seen this slide multiple times. This is International Diabetic Federation is talking that how diabetes is increasing. And similarly, in last 20 years, the number of pharmaceutical products as well as the industry size is also increasing as the number of persons with diabetes is increasing. But still, only 50% of them are diagnosed. Now, what is more problematic is a challenge of pre-diabetes. As we know that already diabetic patients are not getting themselves investigated for knowing that they are having the high sugar. In our country, where we have 77 million people with diabetes, 50% of them, they don't know they are diabetes. In 2021, our own data of IDF is talking 74.2 million, but 50% of them, they don't know they are diabetes. The pre-diabetic population is even more. If you see in our Southeast Asia population, the number of people with IGT is somewhere around 46.9. But one more data from India is saying that almost similar number of persons with diabetes are also pre-diabetes in our country. Again, there is one more challenge. There are patients who may not have the high sugar. They may not have even pre-diabetic population also, but they are at the high risk of developing diabetes. So that's what, if you calculate that number of persons who are having high risk of diabetes, having risk of developing diabetes, then this number will become another 150 million in our country. So, I mean, a challenge is huge. People are not getting investigated. And then there is a role of industry person as a social cause, that if we diagnose them, if we screen them, can we prevent their diabetes or not? Now, this incidence completely in our country is changed in last 25-30 years. If you see the data from 1990, and if you see the data of 2016 to 2020 or 21, you will find across the country, those number of states in our country having the diabetes status less than 4% population, young population, having diabetes. Now they are having more than 7-8% of the adult population have the diabetes in our country. So prevalence of diabetes in our country is increased like anything. But as I already told you, the undiagnosed diabetes in our country is very, very high, and where industry can help us, not only for pre-diabetes, but for undiagnosed diabetes in our country also, because almost 50% of them in a rural area, and even in the city and town also, it is 1/3 of them, they are not diagnosed with the diabetes at the time of diagnosis. They should be having the diabetes and they should be diagnosed early also. Why it is important? Because at the time of diagnosis itself, many of them have complication. They have already abnormal blood sugar level, but at the same time, they have already complication. And this is a one paper from India Diab Care study. A multi-country study in Asia reported a diagnosis of diabetes among Indian subjects was determined at a delayed stage. That delayed stage was so much so that they have presented with complication. We get the patients from ophthalmologist, we get the patients from a foot surgeon, we get the patients from cardiologist or a nephrologist, and they refer the patient that somebody is having already diabetes because this patient has been admitted for retinopathy, for nephropathy, for cardiac complications, for infections, for foot complication. One more challenge is that we are getting diabetes in our country in a younger population. And again, that is the population which does not want to get themselves checked up. If you see the industry, how the pharma industry can help, they can help their own people who are already in this working age group. And I'm sure many of them must be having high sugar or dysglycemia or metabolic syndrome or a pre-diabetic population. They should work on them also. And at the same time, they should also see that how the diabetes can be prevented in themselves as well as for their family members, and how they can help the society for prevention of diabetes. Because the working age group in our country is a young age group, is the country in our country having high risk of developing diabetes or pre-diabetes. And they are already the number of people diagnosed with diabetes in our country, 72% of them are in this group of between 20 to 64. Diabetes control in our country is suboptimal. So this is the data of 2014. And if you see the data of 2020, the status is almost same. Less than 25% of the patients or 30% of the patients are actually having good control of diabetes. So now, in spite of last 20 years of so many medication, so many industry support, so many conferences, so much of continuous medical education program which we are doing in our country, is still the suboptimal control of diabetes remaining, those who are diagnosed with diabetes. Now, why I'm saying this word, it's very important, because my talk is that how pharma industry or in their social cause can prevent the persons from pre-diabetes to diabetes. That is our primary target to talk about. But I'm talking that those patients who are diagnosed, first I'm talking of diabetes diagnosed, 50% of them not knowing. So now to detect pre-diabetic population is more difficult. They already detected diabetes at the time of complication. Then those who are having diagnosed diabetes, those who know their diabetes is diagnosed, even if I show you the data from 1995 to 2005, 15, 18 or 20, what we are seeing is 2/3 of them are not under good control. It means somebody is already with diagnosed diabetes, even he is not able to take care of his diabetes. We are talking something who is pre-diabetes, who is only at the risk of developing diabetes. Now to educate that person, that how diabetes can be prevented, that's only a borderline case. It is extremely difficult for us. The number of persons with diabetes is really a matter of concern. It is a matter of concern for India across the country, that how many people are having diabetes and they are getting diabetes complication. The pre-diabetes, 9 out of 10 don't know they have pre-diabetes. So this is a second major challenge, how to go for them, because 50% of diabetic population, they don't know. Now, those who are about the pre-diabetic, 9 out of 10, they don't know they have pre-diabetes. To explain the patient, when we get the patient whose fasting sugar comes 116, when we explain this is impaired fasting hyperglycemia, it is known as IFG. If your post-meal sugar comes 160, if your HbA1c come 6.2, we explain the patient you are in a condition called pre-diabetes, which is also increasing the risk of cardiovascular complication. It can be prevented. You can prevent your diabetes progression. It is extremely difficult. And one of the most difficult part is they don't know whether they have pre-diabetes also. So 9 out of 10 don't know they have pre-diabetes too. Type 2 diabetes starts years before diagnosis. So I think better to target the population not with the pre-diabetes, rather we should target the population who are at the risk of developing diabetes, because that is much easier rather than someone to have a pre-diabetes. Who are at the risk of developing diabetes or having metabolic syndrome? Very simple. The half of your abdomen, half of your height, If you are 160 or 170 centimeter, your abdominal girth should not be more than half of your height. That is what if it is more than half, it means you are at the risk of a risk of developing diabetes or cardiovascular disease. And it comes one of the criteria for metabolic syndrome also. So that is much easier, whether it is in office, whether in the clinic, with a GP clinic, physician clinic, the person who is coming not for diabetes, and they should be investigated for the sugar. Now, even if their sugar comes normal, they should be educated that how this abdominal girth can be decreased and how the complication of this increasing abdominal girth is increasing your risk of developing diabetes. The other side, those who are diagnosed with impaired fasting hyperglycemia, IGT, or with HbA1c, which is higher than 5.8, they can be further educated for intensively for lifestyle modification for prevention of diabetes. And some of the patients who are having very high risk, they can be given like lipid lowering agent, metformin, or the alpha glucosidase inhibitor for prevention of diabetes too. In our country, even the prevalence of diabetes is very, very high, but the awareness is very, very low. And this is 60% of urban Indians unaware that uncontrolled diabetes is going to affect their organs. So this level of awareness is in our country. Even their sugar is uncontrolled, they don't have that idea that this can lead to the complication. So I mean, to educate them that how your fasting sugar of 112 is going to have the complication like heart problems or a kidney problem, I think it becomes extremely difficult for them. 1/5 of the peoples only they know that the obesity is the primary cause of diabetes. So this higher abdominal girth is really a problem for them. We should educate more for that. Many of the people, they feel that diabetes is primarily inherited because my parents was having, my mother was having, my family member was having, and that's the reason they have diabetes. But it is not true. They should be educated that diabetes can be prevented. Even your family members were having type 2 diabetes. Those who does not have the diabetes, they feel they will never get it. Some of them are 55, 60, they are eating, they are become obese, they are overweight, they feel they are not going to get the diabetes anymore because they don't have, either family history or they have not developed till now. Many of them feel that it is just checking a sugar is sufficient. If their sugar is normal, it means they can eat everything. And those who are diabetes or even those who are non-diabetics, they are ignorant about their sugar level. And there is also one more important thing that many of them, they have the not having family history, they feel that they will not develop the diabetes. This is the reason this one paper just before some time, myself, Anup Mishra and Jyoti Dev had put it that blood sugar level should be considered as a new vital sign. We all know that pulse, blood pressure, respiratory rate, these are the important vital signs. During this COVID time, everybody started understanding the importance of oxygen saturation. Even the general public, everyone was knowing that what is the oxygen saturation in the body. Similarly, the sugar monitoring should be considered as a vital sign in our country. Unless we advertise it so much so, unless we create so much awareness in our country that this is a vital sign for prognosis. If someone have the sugar level high, someone have the higher abdominal girth, it is going to cause the problem or complication in their life. So they should know more about the sugar level. This should be considered as a new vital sign or a fifth vital sign. We have done one campaign for this, being a RSSDA president during my presidency for 3 months, a Defeat Diabetes program, which we have run, reaching out to 100 million people in 100 days. And testing, tracking, and treating them. That was our primary idea of this Defeat Diabetes campaign. For 3 months, it was testing for those who have to have higher risk of developing diabetes. As I told you, it's very easy, those who have higher abdominal girth, tracking for those people who are having diabetes, and treating for those who have uncontrolled diabetes. That was the 3-month campaign program which we have done with a mission that to reach out 100 million people in 100 days. And to declare blood sugar is a fifth vital sign, for which we have done a lot of social media campaign for this. The awareness for pre-diabetic population and awareness for a obese people in our country is very, very poor. And for that, we all can work together. And the corporate social responsibility of CSR activity of pharma industry can help really for that. The person who is having pre-diabetes, he thinks multiple times, what is pre-diabetic? Am I have to get treatment for this? Is there any molecule for this? Whether they go for doctors consultation also is really, even in a city like Mumbai or Ahmedabad or Delhi, which is such metro city, even people don't go with the pre-diabetes. They feel that it is a some sort of a within few months I will able to control, and then they come after 2 years, 5 years, 10 years. When you take the history, we find that before 5 years he had developed diabetes. Actually, it was a sugar which was around 6.2, 6.4. Even if you don't treat the pre-diabetes, they are going to have all those complications with the diabetes can have. So for another 3 or 5 years, they may not develop full-fledged diabetes to reach out to the doctor uh, for treatment, but still they are also can develop all the complications of diabetes. So there is a lot of window of opportunity for the industry, for the stakeholders, for healthcare providers, for health and wellness influencers, for a persons with pre-diabetes. There is a lot of opportunity which is there in the market, because a lot of people with pre-diabetes and they are not aware of it. If you just see the cost of diabetes care, it is not in the drugs or not in the medication. It is in the complication. So I always say the cost of therapy in treating diabetes, or now per se is pre-diabetes, is more with the complications, not with the medication which we treat or the educate which we do. So screening for pre-diabetic, now how it should be done? Should we do with them with the fasting? Should we do with the 75 gram of oral glucose, or should we do with HbA1c? The best way is to do their A1C, because if it is more than 5.7, we can put them on a pre-diabetic, because single test, non-fasting, anytime it can be done. Because to do a OGTT is more cumbersome. Getting the complete fasting plasma glucose was also very, very difficult. What we have done in our this diabetes defeat diabetes campaign, and then we have published the data also in a young population in our country, a countrywide defeat diabetes community screening program. What we have done is that people who are having the sugar first time detected during this campaign, or those who have fasting plasma glucose of more than 110, or those who have HbA1c of more than 5.7 or 5.8, they were detected. And then this data which we have published, that in India actually ICMR or DCGI gives the guideline that those who are above the age of 35, they should get their regular sugar checkup. While in this campaign, we could find there are a lot of people between 20 to 35 in this age group who were detected. It was 11%. I mean, those who are not knowing about the status of their sugar, they were detected first time either pre-diabetes and diabetes. And that's the reason we have returned to DCGI and ICMR that people in India should be screened not at the age of 35 rather than 20 or 25. The pharmaceutical company can play a key role in education and awareness. Up to 80% of the people with diabetes can be delayed or prevented through lifestyle changes. Now we know that even diabetes can be reversed also. So pre-diabetes, definitely it can be reversed if we can create an awareness and education program for them. Companies, pharma company can play an active role in supporting educational program to help the people for better manage their condition too. With diabetes being one of the greatest threats to public health in 21st century, the rationale for strengthening efforts to prevent and controlling this menacing chronic disease is compelling. Pharmaceutical companies will play a vital role in the fight against diabetes by supporting those diagnosed with diabetes to effectively manage, to live their condition, educating those who are undiagnosed or currently at the risk of developing diabetes, or they are already pre-diabetes, advise and raising the awareness among those who may be at risk in the future to take measures to prevent diabetes onset further down the line. This is addressing a policy needs for prevention and control of type 2 diabetes in our country. This is what, and pharmas can be more than medicine by focusing on preventive care. So we just may not be only focus on the medicines, we can be more on prevention aspect too. It's very difficult to change the lifestyle or habits of the persons, because we all know that someone to tell that now you eat more vegetables or avoid fatty meats or avoid fried things or go for daily exercise. These guidelines are really very difficult. So they require a lot of education. They require a lot of awareness. Even people know that it is going to help them. It is going to help them from sedentary lifestyle, if they become more active, people started using now apps by knowing that how many steps they are walking, they are running, all these things. But still, the awareness is to be increased, and where industry can support from this. From drug to cure, pharma's role is really emerging in this ecosystem, and I'm really very thankful for the idea that a talk is given to me on that, how industry can help for prevention of diabetes or prevention from pre-diabetes to diabetes population. We should intervene early to prevent both diabetes, not only diabetes, but diabetes and cardiovascular disease. With this, I thank once again for this opportunity. I'm very much thankful for this.
Thank you so much, sir, for taking us very quickly through what is to be done in this space. As a top doctor, your voice sounds to us as like we should be there in the awareness, in the education, in the prevention part of it. Vivek sir, any comments, any questions to Dr. Banshi? Ashok sir, Sanjeev sir, and Sanjay sir.
Dr. Banshi Saboo made a very, very important statement that the maximum diabetic patients are in the age group of 20 to 64, which means a lot of patients in Gen X may be having this disease in the future. And we have to look at the mindset of the Gen Z. They are going to be digital savvy even before going to a doctor. They may have already diagnosed the disease. They may also know what is the treatment for this disease. And it becomes a challenge not only for the medical professionals or even for the pharma companies, how to tackle these kind of patients in Gen Z. And therefore, many of the societies like RSSDI or CSI or API, they should try to educate the doctors in handling Gen Z patients who are tech savvy and they know what kind of disease, the treatment for the disease before they approach a doctor. Just putting up both, okay, if you have already met doctor, Google, please don't come to me. That is not, what do you say, Dr. Banshi Saboo, on this?
Somebody had seen the Google, then should not come to the doctor. Is it like that? So, many people, they keep on seeing and searching the Google, and they want to know each and every answer from the Google only. It's really very difficult for them to understand. Sometimes they should reach out to the doctors. But the unlucky part is that in India, we don't get the patients who are asking us and coming to us that, doctor, my family have a strong family history of diabetes, or my brother had developed heart attack in a young age. How I can prevent for myself? We see a lot of patients who is coming, a young guy, 45-year-old, coming with his mother or his father, showing his diabetes or heart disease or dyslipidemia or hypertension. But at that point of time, he's discussing everything about his father or mother, but he hardly have any time to understand that whether I can prevent my disease or not. I am 45 also, I am 50 also, whether I will develop all these things in next 15 or 20 years. He is having all risk factor for that. So that requires a lot of awareness. Now, awareness, you can say that after down the line, if 10 years, if every doctor of a diabetes or endocrine or a physician who is seeing 50 patients, at least 10 of them are coming not for the taking the medication, rather they are coming there just to take the consultation, that how I can prevent my disease, how I can prevent my obesity, how I can prevent my abdominal girth, increasing abdominal girth. That is what the success is. So if we all can increase the awareness, in coming decade, in 2030, people should come to us for a prevention. We don't have even preventive doctor also. You will not find any doctor in India who is writing himself as a preventive diabetologist or a preventive cardiologist. They write clinical cardiologist, clinical diabetologist, interventional cardiologist. We don't write, it means we don't have those type of system. We don't have preventive problems. So that is very much required. And there also industry can help us. How this prevention clinic should be, it should look like how diabetes clinic are. So the similar way, how preventive clinic should be, whether in a government setup, public sector, in a private setup, how a preventive setup should look like.
Thank you. Thank you, Dr. Banshi.
Yeah. Dr. Saboo, I had 2 quick points. One is,
Yes.
I think very important that what you said about the population that is susceptible to diabetes as much as people who are diabetic, I think we should start doing some calculation on the impact of productivity loss due to diabetes and hypertension, and
Very
therefore the impact of GDP loss. My guess is that India must be losing about 1 to 1.5% of GDP growth because of diabetes and hypertension mismanagement by
I
patients.
fully agree. And it is going to increase, sir, in
Yes.
next 10 years.
Yes. So that is one. And second is that if that is driven, probably we will get more support to ensure what you mentioned rightfully is that in these diseases, in these two diseases, prevention or avoidance has such a big positive impact on society that we have to push for prevention and avoidance at any cost by changing lifestyles and changing diet. We have to do a lot for people of this country.
Very true. Very true.
Yeah. Let me take up a question to the panel, sir, because after this, it will be a patient video and patient interaction thing. One question to the panel. What is your viewpoint about digital patient counseling system? Means digital and then counseling, they are merging. What is your viewpoint? Anyone can take up this question.
So my personal experience as a doctor, because in last 2 years during COVID time, our digital consultation increased significantly, particularly in the first phase and then during second phase. And patient also started understanding the importance of digital consultation, and we being a doctor. But in India, actually speaking, we are doing digital consultation since many years. With the telephonic consultation, people keep on calling the doctors for their minor or major problems. Then WhatsApp came, and then people started talking to us on WhatsApp also, sending us the message for that. And it had become by ICMR guideline also during COVID time that it is official. You can do a digital consultation and you can charge also, and you can send someone a digitally consultation paper, and against that you can charge. So it has really improved and increased, particularly in field of diabetes, where the clinical examination, if you have patient already seen by you, the follow-up becomes very easy because you know many aspects of thing. And now that video consultation, even if you want to see the face, you want to know some of the parameters, you can ask the patients and you can do. The only challenge is the education. Digitally to educate someone is very, very difficult. The disease like a diabetes require a lot of education for monitoring, education for diet, education for exercise, because in that 5 minutes or 10 minutes. So like in my clinic, what we do is if somebody is consulting, we also tell that simultaneously the educator or dietitian will be also on the board and they will be also doing. So in afternoon time, we still have the slots to do all these things. But that effectiveness of this digital consultation, particularly for lifestyle modification, is really poor. They continue to take the medicine. They will change the medicine also. They will buy the new medicine also, but they will not do. So it is like that while reaching to the clinic, while coming to the clinic, it is more effective. They follow more regularly, and particularly for diet and exercise. That is not followed when it is done digitally completely. But I would like to listen from others also. What is their opinion? Because that's very important.
A quick point is, I think the cost of treatment has always excluded the time cost that a patient spends in travel, the cost of travel, the cost of waiting. And this is something which is a huge burden on the patient. And in cases of chronic therapy where it is possible at times to do consultation through help of technology, we'll have to keep on encouraging that, because ultimately it will bring the cost of treatment down for the patient substantially. Obviously, there are elements and time in that therapy where, as Dr. Saboo, I think you say, patients will have to physically come. But otherwise, if out of the, let's say, 4 or 5 consultations in a year, if 2 or 3 can be managed technologically, it saves a lot of time and money for the patient also. It brings cost of treatment down in our country.
For diabetes, is a once in a year is sufficient if they can do 3 or 4 consultation online. That is what we promote also.
Yeah.
Thank you. Thank you, Dr. Banshi and Sanjeev sir, for answering this question. Sanjeev sir, one question has come directly for you about the change you are asking the industry to do, how to start for this change and make the organizations ready to listen to these trends that you discussed. How to do it means the how is still a problem.
I think it's a very simple answer to that, Swati, is that be bold, be tough, be bold. Open your mouth and say that I want to do this. Most of the times, people are in organizations like to say yes, sir, and really don't talk anything about their mind. Yeah. So if you're bold and you're able to talk, I started my life that way. I kept on speaking whatever I wanted. Earlier, people might used to call me, maybe this guy doesn't know a thing, is arrogant or he's speaking too much. But the people realize that, this guy is not meaning any of this. It is just that trying to make a change in the way we work. So all of us have to be bold enough to speak up and start the change. Nobody else is going to change. We have to change.
Yeah. Thank you, Sanjeev sir, for this. From this panel, we will take the learning forward. We need to speak up and ask for change, do the change, be the change. Thank you to the dear panel members who have joined us till now. We will move towards some different sort of session now, workshops and all. Thank you, Dr. Sanjay. Thank you, Mr. Sanjeev, and thank you, Dr. Banshi Saboo, for joining us today and enlightening the audience.
Thank you.
Thank you. Yeah, Ashok sir. Yes.
I would like to personally thank Dr. Banshi Saboo taking off his time from a busy schedule of the last 3 days international conference that with multiple sessions that he is having in Bombay. He is not in Ahmedabad, he is in Bombay. And thank you, Dr. Saboo, for accepting the invitation and taking time out from this international conference to be with us.
Thank you,
today.
Guptacharan. Thank you. It's all my pleasure. I am obliged for this. Thank you, sir.
Thank you for the platform, Pharma State Academy, Dr. Banshi, and 300+ participants also. Thank you for enlightening us today.
Thank you, sir. Thank you.